and a warm welcome to all of you joining the webinar today. Thank you for taking the time to participate today and hear about these wonderful peer support specialist programs. Our agenda today will include a brief overview of peer support specialist programs. Much more of the information that you will hear today is in a newly published toolkit intended to help communities implement peer support specialist programs. Most of our time together today will be spent hearing from a panel. The quotes are from a series of videos developed as part of the National Quality Improvement Center for Collaborative Community Court Teams. The videos feature short interviews with peer support specialists who work with families affected by substance use disorders and involved with child welfare services. These quotes and the experiences highlight the power of peer support to instill hope, change the trajectory of families, and build bridges between families and child welfare services. You can access these full videos by clicking the link at the bottom of the slide. Now that we've established what peer support programs can do, hopefully that was the intention of those quotes in the previous slide. Let's explore a little bit what peer support specialists do to achieve those remarkable outcomes. Let's hear from you. Take a look at these potential roles on this slide. Which do you think peer support specialists hold? Please select which roles that you think are applicable to peer support specialists. We will launch a Mentimeter poll, and you will be able to submit your responses by clicking on the link that should be available to you in the chat box. All right, it looks like most of you are going to go with all of the above, which is what I anticipated. And then if you're like me, every time there's a multiple choice response option on an exam, I would always think, oh, all of the above is probably correct. So thank you so much for participating in that. Again, a few more quotes. These quotes are again from the National Quality Improvement Center for Collaborative Community Court Teams videos, and really underscore what peer support specialists do in their own voice. I'd like to draw your attention to the last quote. A lot of people were unsure of what I'd bring, and I was unsure too. In addition to the concrete roles, service engagement and coordination, recovery coaching, parent mentoring, family advocacy, and so forth that we looked at in the previous slides, I wanted to take some time to highlight the role of the peer support specialist and sometimes bridging families and the service systems that serve them. So when child welfare and substance use disorder treatment professionals were asked what they hope families experience when they encounter their systems, they said, well, we hope families are not judged, that they receive support, that they receive effective care, that there are partnerships available between service systems to make sure that families receive support, effective care, have access to timely resources, get the help that they need. They hope that families experience understanding, empathy, and kindness. Now, when parents and caregivers with lived experience in recovery from substance use disorders and as a recipient of child welfare services were asked the very same question, they shared the same hopes. Both of these groups identified the same hopes for families. I'd like to pause for a moment here to reflect on the power in that statement, particularly as we reflect on the quotes earlier in the presentation. Especially, change word on the street that child welfare wants to take your children to child welfare wants to help you. The lived experience of peer support specialists is invaluable and a key component in helping to bridge service systems and the families they serve. The lived experiences of recovery from a substance use disorder and involvement with child welfare services is a critical component to engage and support parents and their families with their experiential knowledge. Peers serve as an example of hope that recovery is possible and serve as trusted allies for parents and families as they navigate the child welfare, substance use disorder treatment, and court systems. In today's webinar, I hope that you are inspired to implement a peer support specialist program for families affected by substance use disorders in your community, or at the very least, gain an understanding of how peer support specialist programs help families. In such, the National Center on Substance Abuse and Child Welfare has developed a toolkit to help communities implement a peer support specialist program. You can access this implementation toolkit by scanning the QR code on the screen or clicking the link on the bottom right hand. You'll also see one of my colleagues pop in the link to the toolkit in the webinar chat so that you'll have immediate access to this toolkit. A quick overview of the implementation toolkit. It was developed from information gathered from an in-person focus group in March of last year. The focus group included representatives from peer support specialist programs from across the country. They included program managers, state leaders from child welfare, substance use disorder treatment and court systems, and peer support specialists. The focus group was asked a variety of questions, such as, what makes peer support specialist programs work? What are the typical roles of peer support specialists? What are the goals of peer support specialist programs? What should communities who are interested in implementing a peer support specialist program know? Before we dive into the meat of the implementation toolkit, first, some brief outcomes. Peer support specialist programs have demonstrated numerous improved outcomes for parents, children, and families. These include improved treatment start time and time in treatment, both of which are critical to recovery from substance use disorders. Improved outcomes include decreased rates of children entering out-of-home care. And when children are separated from their families, these programs have demonstrated improved family reunification rates and decreased re-entry to out-of-home care. There is some evidence that peer support specialist programs may improve outcomes for families of diverse racial and ethnic backgrounds. For instance, compared to Black children who received child welfare services as usual, Black children who were served by the sobriety treatment and recovery teams model were more than 3 times as likely to be with their families and not experience recurrence of maltreatment. These outcomes were found at 12 months post-intervention, speaking to the longevity of their approach. Now back to the toolkit. When the focus group was asked what makes peer support specialist programs work, they identified the role of lived experience as critical, particularly the ability to experientially understand the experience of attaining recovery from substance use disorders as a parent and who has received services from the child welfare system. Collaboration among the various service systems, including child welfare, substance use disorder treatment, court, and other service systems, was also identified as a key component for the success of peer support specialist programs. These partnerships ensure access to the comprehensive services that help families affected by substance use disorders. These services include treatment and other services for parental substance use and mental health disorders, screening and interventions for children's social emotional needs, parent-child strengthening interventions, housing, nutrition, and other services. Module 2 of the toolkit describes key steps to build a collaborative infrastructure. Some key steps that the toolkit dives into includes convening and building a collaborative implementation team. The toolkit includes tips to develop a shared vision and common goals. Another key step in this process is conducting an environmental scan to identify and understand the needs of families in the community. Environmental scans help identify the demographics and characteristics of the population to be served, including gender, race, and ethnicity, which can help ensure that the program engages the right partners and hires staff who represent the population served, or the population that the program intends to serve. The environmental scan could also include an assessment and review of practice and policy issues in the community, state, or jurisdiction. This could include looking into state certification and licensing requirements for peer support workers, identifying potential funding sources and streams, and assessing the availability of recovery resources in the community. Key here, I know I said a lot in this one slide, but key here is to have individuals with lived expertise on board throughout the implementation and ongoing program assessment efforts. Sorry about that. For instance, as part of the environmental scan, collaborative teams can host focus groups with parents and family members and other community members who had previous involvement with child welfare services and who are affected by substance use disorders. This process can help the collaborative implementation team glean valuable insight into how families have experienced the service agencies with which they were involved and understand the barriers and challenges that they have faced. Module 3 of the implementation toolkit outlines key steps to implement a peer support specialist program. These include collaborative development of program goals to ensure alignment between collaborative partners, establishing staff roles and responsibilities, and selecting evidence-informed practices. We will go into a little more detail with the next few slides. And again, a quick plug for the implementation toolkit. You will have access to a lot more information on these key program design steps with the information contained in the toolkit. So collaborative development of program goals is important to ensure alignment among partners. There is variation in goals among peer support specialist programs. Typically, their goals can be grouped into 4 broad areas: increased rates of entry into, engagement in, and completion of substance use disorder treatment, increased rates of recovery maintenance, reduced rates of recurrence of child maltreatment, entry and re-entry, and time spent in out-of-home care, remove barriers and improve communication between child welfare and substance use disorder treatment staff. These 4 goals can serve as the foundation for a comprehensive approach to improve outcomes for families affected by substance use disorders. As you look through these goals, you can see that these goals cross over the substance use disorder treatment and child welfare service systems. Based on the collaboratively agreed upon program goals, collaboratives can establish the expected roles and responsibilities of peer support specialists. Again, there's variation among programs in the roles held by peers, and they can be grouped into 3 general categories: coaching and mentoring, roles intended to improve parents and family service access and engagement, and systems liaison. Coaching and mentoring includes a host of tasks, including providing ongoing and consistent in-person visits and phone contact and other forms of contacts with the parent and or family, modeling what success-free recovery looks like, sharing inspiration and hope for recovery, helping parents set the recovery goals, coaching parents in coping and other skills and strategies, motivating parents to start and remain in substance use disorder treatment. Improving service access and engagement in services could include helping parents schedule their substance use disorder assessments and helping arrange transportation to treatment and other services, helping parents locate recovery meetings, and providing referrals and links to community services. The role of the systems liaison includes working directly with child welfare case managers. This includes perhaps partnering with child welfare case managers or social workers on home visits to the family. This could also include attending and speaking on the parent's behalf during collaborative case planning meetings or sometimes during dependency court hearings. Part of establishing peer support specialist roles and responsibilities include collaborative development of clear information sharing policies and protocols. Typical information shared by peer support programs to collaborative partners include parents' progress in treatment and participation in services, as well as the family's strengths and some of their needs. Sometimes challenges for some programs include when parents return to substance use, or there is an indicator of a potential return to use, or there are child safety concerns. First and foremost, clear information sharing policies and protocols are needed to ensure effective communication. These policies should include use of a release of information form that obtains parent consent for disclosure of information, for what purpose and to whom. Collaboratives can use a twice-monthly report that briefly summarizes parents' progress in treatment, such as whether the parent attended individual or group counseling and the results of drug screens. Information can also be shared via collaborative case planning meetings, such as team decision-making meetings to help coordinate services for families. Programs should be knowledgeable of their state's mandatory child maltreatment reporting laws. Most peer specialist programs fall under the purview of mandatory reporting laws, with the exception of peer support specialists who are employed by attorneys who are then exempt. Peer support specialists who are mandated child maltreatment reporters are required to comply with state laws pertaining to the information they must report, such as if there's a return to use that may lead to child safety concerns. Peer support specialists provide support and coaching that empowers parents to be honest with their treatment team and to be the ones to communicate any return to use on their own. Specialists can educate the collaborative partners on return to use as a potential part of the substance use disorder recovery process and an indication of an unmet need for the team to resolve. These protocols should be part of routine and ongoing training. Additional considerations for implementation of a peer support specialist program include determining the frequency and duration of contacts with parents and whether transportation to substance use disorder treatment and other services is provided by a peer support specialist. I'm going to try to rush through this slide a little bit because I want to make sure we have time to hear from our panelists. So again, you probably hear a theme. The frequency and duration of contacts with parents within peer support specialist programs vary and depend on a variety of factors, including the caseload of the peer support specialist and the expected roles of peer support specialists. And then we've also heard that some peer support specialist programs determine the frequency and duration of contacts really based on the family's needs. And these contacts also vary. They can be done in person, web-based, phone-based, or via text messages. Collaborative partners can take these factors into account when developing guidelines for their programs. And in module 2 of the toolkit, you'll found a little bit more detailed information, such as kind of the more detail on the frequency of contacts. So some programs provide weekly contacts, some programs provide twice weekly, some programs provide twice monthly, and so forth. All right. Now we're going to get to the panel discussion. But really quickly, last but not least, Module 4 of the toolkit discusses strategies to recruit, hire, and retain staff for peer support specialist programs. These workforce issues, particularly retention and career development, are experienced as challenges by various peer support specialist programs. So we have gathered a panel of colleagues to discuss these issues and strategies to overcome these challenges. So I'm going to do a quick introduction of our wonderful panelists. We have Danya Flanoy, who is a senior program associate at the National Center on Substance Abuse and Child Welfare. Prior to joining the National Center, her depth of experience includes serving as a social service worker and supervisor for the Sobriety Treatment and Recovery Teams model, a peer support program for child welfare-involved families. Samaje Newton is a peer support recovery specialist at Shields for Families in California. He works with a variety of individuals to achieve their goals, such as reunification with their children, maintain compliance with parole or probation conditions, and re-enter the community with stability and focus to live a productive life. Chelsea Shatzoy, and I'm sorry if I didn't say your last name correctly, is a case manager at the Cass County and St. Joseph County Specialty Courts in Michigan. Her work with families is based on a comprehensive and holistic approach to assist them in their recovery and life goals. So for our first question to our panelists, to start off the panel, let's try to paint a picture for our audience. What do the ins and outs of a peer support specialist program look like? What does a typical day as a peer support specialist or the supervisor of such a program typically look like? Let's go ahead and go with Samaji first.
Hello, everybody. Nice to see you. Thank you very much for joining us. and I'm happy to be here, and I hope that everybody's having a blessed day. Um, a typical day as a peer support specialist is what I would consider a great day, a busy day too, also, because we're very busy, so especially with the caseload and the flux of people that we want to help daily. But it's a great day. It's a great day to help someone that might have been through the same thing that you have been through, if not even similar. So it's very great to help your community and help your fellow peers and help people get through things that you probably did not get the help at the time when you were going through it. And you can guide them, mentor them, assist them, and always provide the resources to them and let them know that it's someone out here and someone here that can help you. No matter what you're going through, you're not going to go through it alone. And that is a typical day as a peer support specialist. And it never stops, even if you're off the clock.
Thank you, Shamaje. Chelsea, would you share a little bit about what your typical day-to-day experience looks like?
Sure. Thank you so much. Thank you for having me. For me, my days kind of vary from one day to the next, and Samaje is right. We don't typically take too much time off. We do have some clients who are in need of assistance, in the middle of the night. And so with our boundaries set, we do accept some of those phone calls. So for me, facilitating treatment and recovery groups are a big part of my day. Trainings, helping with our staffing team, some of our more court professionals understand some of our evidence-based treatment and how that affects families and individuals in recovery. Also, kind of being there as a gap filler between professionals that are in the court, more or less the attorneys and the judge and some of the DHS agencies, and then also with the families. We also attend collaborative case management meetings for several of the problem-solving courts that I'm involved with. We do provide transportation for families, children, parents, whatever the need is. Also, generally, we will attend appointments with them just as needed support.
Thanks, Chelsea. And then for a little bit of a shift in perspective, Danya, could you share from your experience as a supervisor of a peer support specialist program, what the day-to-day looks like?
So, Han, thank you for that. And thank you. I'm glad to be here. And just kind of shifting, putting on the child welfare lens, because that the START model is a child welfare service delivery model. So it's embedded in the child welfare agency. So just to give you guys a little context of where, I'm going to answer my questions from. And so one of the things you have to consider when you integrate peers into child welfare is that you cannot underestimate the significance of in the change of becoming a recipient of child welfare services to now becoming a child welfare employee. And again, I'm coming from the perspective of the START model, where we hired former child welfare clients as employees. And so that shift is major for that individual and for the office that they're being integrated in. And so you have to really prepare the office environment for that. Peers, they face stigma from colleagues, from families, from leadership when they enter into that change in this role. And so as a supervisor, I had to really be intentional about creating an inclusive environment that is inclusive to them. But even more importantly, Han, I had to look at my biases. Okay. So as a supervisor, though I have been working in child welfare for a very long time, I still come in with my own biases when it comes to substance use disorder. So I had to look at that. So I can't transmit what I don't have. So taking a moment to step back to say, okay, what are my biases when it comes to working with families or working with people with substance use disorder? How do I address it so that the peers that we hire have this sense of inclusivity? They feel to a part of the child welfare team and not this separate entity, because fostering that environment that is inclusive really helps them to thrive. It helped our peers to thrive. So really kind of setting the environment office culture up to receive them and into this new environment. But also too, as a supervisor, I had to be sensitive in my approach with working with our peers who were in long-term recovery, because this child welfare is difficult. And so being able to make sure that I allow time for them to debrief, create a safe space for them to voice their thoughts, their concerns, what is working for them, what is not working, and really address though their concerns frequently and quickly, because I wanted our peers to be successful. And so though supervision remained the same between peers and social workers, you do a little style flexing in the approach of your supervision with peers. So not to make them feel different, but just a little special.
Thanks, Dania. I think sometimes we also hear from peer support specialist programs, what should be a typical caseload be? And then could you speak to some of your experience in that?
Okay, well, again, I had to chuckle because we're talking about child welfare here, okay? So a manageable caseload for peers. Now keep in mind, for the START model, our peers are coupled with child welfare workers. They work in partnership with them. So they don't have an individual caseload and their child welfare partner has an individual caseload. They share a caseload. So the manageable caseload that we set, the standard that we set for our family mentors, and I have to refer to them as family mentors because this is what they were, they were classified in START, was between 12 and 15. That's a manageable caseload. Is that ideal for some child welfare offices? It wasn't for mine because I'm from, it wasn't for mine. Some, it may be. But to truly manage the complexities of working with families who have substance use disorder and the multiple needs that they have, 12 to 15 is ideal. And the START model, because we work with the entire family, making sure that caseload is manageable is very important so they can spend the time to really help parents on the road to recovery.
Thank you, Dania, for that. And excellent points from all of our panelists. We're going to shift gears again for the next question. How do you or your program work collaboratively among systems? So Samaji, can you share a little bit in your program what that collaborative approach looks like?
No problem. So the collaborative approach with Shields for Family is that we have a lot of services that we provide internally already, which consist of employment, housing, legal services, mental health, substance use, food giveaways, and everything on our sites. We have over 28 sites currently right now. So we have a lot of services within. We also have family preservation and everything. So each one of our sites has a particular field that they work in, but they also can lean over to another site if they need assistance or anything else. We also do what we consider as outreach with our Jericho Vocational Service Program, which is we go out into the community and attend job fairs. We attend resource events. We collaborate with other programs that, even if they are providing the same services as us, the major thing and the major saying that, well, one of my sayings that I've been teaching all my coworkers is that if we can't get it, or if they think we can't get it, we're going to go and find it. So there's never going to be a time when you're going to be like, oh, Shields couldn't help me with this. No, Shields is going to go find what you need. If you need it, that's what we're here for, and that's what our job is. So our major collaborative thing is outreach, connecting with the other programs, connecting with certain programs that have services that we might not have. So that way, if a client does need, for example, if we do not currently have transportation currently, because it's always shifting with fundings and resources and everything else, we will find a program that will provide transportation for our client for that particular service or assistance. And we will collaborate with the supervisor, our coworkers, and we would work together to provide the services and assistance that our client needs. And the same with the other program. If they have something, they can be like, hey, I know Mr. Newton at Shields can help you with housing. I know Mr. Newton knows employment and very close with Allied Securities, and he can help you get a guard card. Let me email him. Let me call him. Let me link you together with him to get you these services to make you stable and re-enter into society in the best way, standing on 2 feet and with your head held up.
Thank you, Samaje. It's so critical that we ensure that our families are really wrapped and have access to all of these various services. Danya, would you like to add anything in terms of the role of peer support specialist programs in ensuring a family-centered approach?
Well, you know what, just to add a little bit to that is that one of the things when it came to the START model is that we really, because it's a family-centered approach, collaborating with our community, other family service systems was critical in making sure that the success of not just our families, but the peers that were working at child welfare. And so a part of that collaborative effort was really being intentional about meeting with our providers, our partners, before we even initiated and start 20, 30 something years ago. And so we had to meet with them. We had to talk to them about what our plan is. This was new. We're talking in the 1995, 96. So this was a new thing, hiring someone who was in long-term recovery, someone who also has child welfare experience into the child welfare office. So we had to make sure that our providers, our community partners knew that our peers aren't clinical. They're not clinical social workers. They are someone who is bringing this lived expertise to help work with our families who were struggling at that time with substance use disorder. They are a part of that child welfare team. And so we wanted to make sure our collaborative partners knew and treated them as such. We really had to educate them on the peers' unique function and their role on that team. And we had to really ensure that our collaborative partners really understood confidentiality regarding the peers. Because again, we're talking about hiring people who were once recipient of services that now they have to work collaboratively with maybe a treatment provider that they once participated in their treatment services. So we had to really talk to them about confidentiality when it comes to working with our peers that were in child welfare. So I think that's additional thing that that I wanted to add to that conversation.
Thank you. And again, a quick plug for the implementation toolkit. If you go to module 2 of the toolkit, you'll see some tips and guidance, as well as a referral to another one of our publications on kind of where do you start and where do you begin in convening and implementing a collaborative approach. So if you go to module 2 of the toolkit, you'll see some tips and hopefully some helpful information that could be helpful in that area. We also have a publication on disrupting stigma to speak to the points that Danya brought up. So if somebody from the National Center team could go ahead and include a link to the Disrupting Stigma publication in the audience chat, that would be great. All right. The next question I think could be for Chelsea. How were individuals with lived expertise included in the development or implementation of your peer support specialist program?
Thank you. So I just want to say first off, like Danya, like having peer supports working in your system for that long is just amazing. So kudos to you guys. That's fabulous. We've been using them for not as long as you, but about 13 years now. Our program with peer supports and coaches, it was created or started by our family treatment court coordinator at the time and our head judge at the time. So early on, the program coordinator, she would engage our graduates of the family treatment program, our family treatment court, and then other specialty court programs that we had in the area, not just necessarily our county, but neighboring counties as well. And those who she saw like this potential in, she would seek them out and she would come find you. Like she would go to your house, she would sit on your couch, and she would just explain like what she was thinking, you know, kind of like just give you an example of, hey, do you think that you could help with this? Or, you know, there's certain individuals who really aren't talking to us. Maybe you guys could help with that. So she would seek them out and just really encourage them to be involved. This is how I started my career with peer support and in the courts. And so that was just amazing. She was just this really intense recruiter for peer supports. And then she would sit us all down and ask us, okay, so what do you think? She really gave us all a voice. What do you think about this? And what do you think about this? And she would ask us and truly mean it, like, how do you think this could be made better? And so she really just gave us an opportunity to give feedback to the system, which really wasn't something that we had encountered previously. And then also input from those with lived experience. It comes in many, many forms and directions. And peers have been involved in the development of various other programs for families affected by substance use disorders. We have different ideas on like fathers being more involved and getting healthcare to the door, you know, for people who aren't able to come and seek it out, offering transportation to drug testing, you know, in rural areas. It's really hard to find rides sometimes, and these are some pretty important appointments they have to get to. So we just try to help in all of those areas.
Thank you, Chelsea. Danya, did you want to add to that response?
One of the things I was thinking about as we're talking about how do you get people with lived expertise is that one of the things that START is intentional about, what I would say to those who are thinking about implementing a peer support program, is that you want peers who are reflective of the community in which you're establishing your peer program. Who better to know what the community resources have to offer but those who are in the community. And I think that sometimes, you know, as what Chelsea said, the person, hey, you may have to go door to door, knocking on the door, looking for those individuals who can add value to your program. And so I really think that it's really important to make sure that those the peers that you hire are reflective of that. And then who else thinking also too, when you're developing, thinking about a peer support program, getting people with lived experience who can speak to what the community needs and how your peer program can fit into the community versus you trying to have the community fit into your program. So if that makes sense. So sometimes we have these new programs and we say, oh, okay, we're just going to take it and put it in this community. And it's going to work. No, you have to see how the community is going to fit and adapt and adjust and create and support the peer program that you are considering. And that's why you bring in people with that lived expertise who are reflective of the community. I think that's the only addition I would add.
Thank you. Great additions. And then thank you so much, Chelsea, for that. I think great information to share with our audience is very concrete examples of how do you potentially, how can you conduct outreach so that individuals with lived expertise can be actively involved in developing programs. Thank you for that. So switching gears, the next question addresses some of the workforce challenge issues that we hear sometimes peer support specialist programs experience. What are some strategies that your programs implement to recruit peers? Danya, can you go ahead and go first?
Well, and strategies that we use to recruit peers, I think one of the things that we did, we always looked at previous clients who were parents that were involved in our child welfare system and involved in START. We recruited from there. But we also we went beyond just the standard LinkedIn or Indeed and posting like that. We had to go to where our you know, parents were, where people were. So that meant going to the treatment centers, going to the local barbershops, putting up flyers, recruitment flyers like that, going to your local grassroots community organizations that may or may not, just may be small, but just been established for 30 years in the community, just helping out those in the neighborhood, going there and kind of recruiting from within. You know, we recruit from within and we recruit from without within that community. So those were some of the things that we look to do with recruiting for our peers in our child welfare system.
Thanks, Danya. Samaje, anything to add? in terms of recruiting peer support specialist for programs?
Yes, I'll add a tad bit on that. Ms. Dahlia kind of took it away, but I'll add a tad bit on that. So, kind of in relation with Ms. Dahlia, the way she said it, Shields loves to hire within, and the good thing with Shields is that they get to see the growth of the peers because it's a one-stop shop. So if you've attended substance abuse, if you've attended mental health, you're gonna, after you graduate, after you attend and you could get your completion, you basically walk literally 3 doors down or in the next hallway, and then you're at our Jericho Vocational Services. You're doing job resumes, you're doing cover letters, you're doing mock interviewing, you're getting employment linkages. You have a CHW that's working very closely with you. You have transportation to get you from and to interview clothes provided to you. So the great thing about hiring within and knowing is you see the growth of the peer. You get to see the process. You know if this person is either falling off or if they're not going to go all the way through. And then also you give them chances, which was provided to me. Hey, Mr. Newton, would you like to set in this group? Okay, set in 3 groups. Hey, Mr. Newton, why don't you facilitate the groups? Why don't you see, let's see what you can do and give them chances and provide it for them. And then once the hiring process and the recruit process is done, they have everything they need to get hired. There's nothing else. They didn't have to go anywhere. Shields provided everything for them. And also, I do believe in the outreach part because it is very important, which is something that Ms. Danya said earlier a little bit. I'm going to piggyback off of that, is to know your community. Where my site that I work in, I live 10 minutes away. So I know my community. I know the conversations that's being had. I know the virus or anything that the community needs within. So when I go to work, I already know the client base that I'm dealing with, I already know kind of what resources is going to be needed or assistance is going to be needed because I've heard this conversation. I've seen this while driving to work. I know what needs to be done or what needs to be changed, or hey, we need to have extra food banks. Hey, we need to have extra recruitment. I've been seeing people talking about getting in this line of work. We need to go here to the barbershop. We need to go to the food for less over here. I've been seeing a few people standing out doing the work, but not even employed with us. And they're still helping their community with free use with no pay. They would be a perfect use and a perfect source for us. So that's all I wanted to add on that, Lord.
Thank you. Again, excellent information to share with our audience. Very concrete how to potentially recruit peer support specialists if you're looking to staff these programs and implement these programs. Our next question is also about workforce issues. There's often turnover among staff, resulting in lack of access to peer supports for families. Could you speak about those challenges that you or your program has experienced and strategies that have been or could be implemented to address those challenges? So Danya, you're first up.
So one of the things I want to say for us, because our peers were hired as county employees, government employees, there was often mobility that they can move from within. But as a larger scale, just working with the National Center, just thinking about it's really crucial to create a pathway for upward mobility. And so how do we do that? If you offer tuition assistance, if you offer, additional trainings that can help allow them to move up within your organization. We've seen numerous peers, family mentors that were and hired with our agency that will take advantage of our tuition assistance at the time and will become social workers, supervisors, shared decision-making facilitators. They moved up within our county agency. So that's really important. If they're not county employees and they're contracted, making sure that the pay is equitable. We need to pay our peers what they're worth. Okay, we can't say they're so valuable to helping families with substance use disorder, but they're not paid for that. And so looking at that, looking beyond what degree, what piece of paper you have, and paying them based on skills and the lived expertise that they bring to the table to help support your program. So making sure equitable pay. Leave policies are consistent with the organizations they're working for. So if they're working with child welfare, and you have separate leave policies, you want to make sure that they're consistent, they align, so it won't cause any tension, because I'm already coming in as a peer, sometimes in organizations that have this stigma and afraid to be treated differently. And so when I know that you may get off for Juneteenth, but I have to work, that may cause some I don't want to say tension, but a little disruption a little bit. So think about that, something as simple as leave policies. And then also looking at what else, if workers or whatever are given bonuses and things like that, how can you compensate your family, your peers, if, say, for instance, they work for a county government and they're getting hazard pay. I'm using COVID as example. Some child welfare staff got hazard pay, but peers did not, because they were contracted employees. So what kind of tension, what is that, again, further isolating that peer from that you're different than me, but we value what you bring to the table. So those are some of the things that I think how you address working through those challenges that some peer programs may face when they're implementing.
Thanks, Danya. Chelsea, any suggestions?
Yeah, so Danya, all of that, absolutely amazing. That has been one of the most difficult challenges, I believe. Thinking out of the box is our default, and that's amazing, but also understanding our worth. And when you really see somebody who is able to make a change in your agency, in your community, being able to compensate them, benefits, time off, competitive wages, tuition assistance, encouraging them. Yes, you can go to college, you can get a degree. What does that look like for you? All of those things are amazing and would really, I think, make a difference in being able to keep your peers. Once you get one who's, used to your agency, used to the people who work there, your community, the clients you have coming in and out, the kiddos who are involved in the welfare system, keeping those who have built rapport with your families. It's so critical, and really compensating them for all of that. So I think that's amazing. And yeah, that's basically all I would have to say about it. I would just agree with everything Donya just.
Thank you, Chelsea. So unfortunately, we have one time for one more panel question, and then I wanted to save some time to answer at least some of the questions that came in from the audience. So the last question that I would like to pose to our panel is, what is one piece of advice you would give to a child welfare program or professional who would like to start a peer support specialist program? Samaje?
Mm-hmm.
Okay. You said one piece of advice for a peer support specialist program?
Oh, what is advice you would give to somebody who is interested in implementing a peer support specialist program?
Oh, okay. Well, the advice that I would give is to do your homework very well, talk to fellow peers as of ourselves, understand the hiring process and the process of being a peer. And to piggyback kind of on what Ms. Diane said, we all are human, but at the end of the day, you have to understand that we've been in them shoes and been through things too. So with our workload, our caseload, and everything else, sometimes there's triggers and things that happen. So you have to understand how to treat your workers properly, all in total, but also you have to be fair. The pay rate, the vacation times, the sick times, everything has to be put as fair as possible, because it is a tough kind of stigma with peer support specialists coming into the workforce, because it's like, hey, why they didn't go to school for this, they didn't do this, they don't have a degree, they don't have this, they ain't been doing this that long, they just went through something. So you have to pay attention to all them things and do your homework and do your studies especially if you're gonna create and bring into a program. And also understand, to piggyback on something that was said earlier, also understand where and how and what the community that you're putting the program in. Go around and figure out, what do the community needs? What resources and assistance do they need? How best to implement this program to assist the community, not just to stick a program here and be like, hey, that's going to help them. That's not going to work. It's not going to work at all. So do your homework. That's the best thing that I can say.
Excellent advice. Thank you, Samaje. Chelsea?
So peer support programs help both families and the systems that are serving them. From a systems perspective, understanding lived experience from a peer's point of view, it really will assist in understanding the families and individuals that you're serving, and also at the beginning stages of their journey. Pick a peer's brain, talk to them. We are more than willing to talk to you about our experiences, all the weird questions, any of the stuff, that you have questions about that you can't really ask the individuals you're serving currently. Talk to a peer who's serving families in your agency or in your community.
Thank you, Chelsea. And Danya?
So from a child welfare lens, you got to ask, my advice would be, you need to talk to frontline staff. And I'm gonna say we, because I was a frontline worker for a number of years. I was in child welfare for 20 years before coming to the National Center. So as a frontline worker, we want to know when leadership comes to them and say, hey, we're about to do this new fabulous initiative. Frontline staff are overworked. We're taxed. We have a ton of cases that we need to address. One of the questions that may come to, I'm going to use myself as an example, that come to mind is, what's in it for me? How is this new initiative, one, going to help the outcomes for my families that I'm serving, going to help reduce my caseload, and ultimately help families stop coming in and out of the system? And so you have to get frontline staff buy-in. Leadership, me being someone who was in leadership in child welfare, we will often just throw things out there and say, this is what we're doing, but without even asking, do you think this is going to work? And if not, why? And how can we make it work? So I think really importantly, just get frontline staff buy-in and input.
Thank you so much. That was everybody. I would like to give a thank you and a round of applause to our wonderful panelists. I hope you've learned from them as much as I have in this process.